You're watching a Youth TV, empowering you.
Hey there! Do you want to learn camera skills? Do you want to learn how you should record your videos? Do you want to learn different camera settings? Do you want to learn how you should set up your place for a good recording? Just join our online media skills here at AIT TV, and we'll be giving you these skills, what you call the 21st century media skills. Check out the numbers you can see right here, and we'll be getting in touch with you.
AIT TV, empowering you.
Good evening, viewers. Welcome to our weekly segment on health and lifestyle show here at AIT TV. I'm Dr. Agaba David Collins. I'm a final year resident in obstetrics and gynecology at Mbara University and the Mbara General Referral Hospital. Today, our topic is going to be antenatal care, and we'll begin by understanding what antenatal care is. So the antenatal care is the care, medical care that pregnant women receive in preparation for their safe delivery. Now, you may ask yourself, why antenatal care? Now, it's important that all women, when they get pregnant, or even before they get pregnant, should be under the care of a qualified, trained person in handling issues related with pregnancy. So this could be a midwife, it could be a doctor, it could be a specialized obstetrician or gynecologist. And this care is basically that the doctor and the patient walk this journey together throughout the entire pregnancy until the mother delivers the precious baby that they are carrying. Now, it's important that all pregnant women get antenatal care from a qualified health worker. And the reason is simple. I know we have read stories, we've heard stories from our grandparents that they never used to have antenatal care. They used to just get pregnant and wait to deliver. Well, that can happen. But we do not know which pregnancy is going to be complicated and which one is not going to be complicated. So when women become pregnant, there are some conditions that they can develop, and these conditions can put their life and the life of their babies who are not yet born at danger. For example, mothers could develop raised blood pressure, which we call hypertensive disorders in pregnancy. They could get abnormal regulation of blood sugar. They could get things like gestational diabetes, and they could develop all other complications, including bleeding while pregnant, and also things like baby dying in utero when the baby is not yet born. So because pregnancy has a lot of associated complications, it is important that even before the mother conceives or gets pregnant, they should be in touch with the health worker who will assess them, and if you found them fit to conceive, give them some preconception counseling and medication, then they can conceive. For those who are found unfit, then either you could first optimize them before they can conceive, and for those whom you think that pregnancy is going to be contraindicated in them, then you advise them accordingly. Now, once the pregnancy has happened and this pregnancy has been confirmed as it is present, then it is important that the mother begins to see the health worker. Now, the Ministry of Health of Uganda and also the World Health Organization will recommend a minimum of 8 contacts. So we want to call them contacts now instead of visits, because we want to make it easier for the patients or the mothers to get in touch with the health worker. That it does not necessarily have to be a physical visit in the hospital, but probably you could use other means of getting in touch with your doctor, and then the doctor is able to advise accordingly. What is the importance of all these 8 visits? The 8 visits have been organized in such a way that they take into consideration the potential complications or potential problems that can arise during the pregnancy. And the timing is in such a way that the visits will be more frequent in the last quarter of the pregnancy, and then will be a bit less in the first third of the pregnancy. So in the first third, you need 1 visit. In the second third, you might need 2 to 3 visits, and then the majority of the visits are in the last third of the pregnancy because of the associated complications, both the mother and the baby. And what happens during antenatal care? So antenatal care is a whole big package. Away from detecting any problems of pregnancy, the health worker helps you identify and also monitor how the pregnancy is treating you, as well as how your baby is responding while in utero. In addition, the health worker also discusses with you about how to prepare for the delivery, and also being prepared for any emergencies that might arise during the pregnancy. Like we've said, that a lot of conditions can develop during pregnancy, and most of them are emergencies. They cannot wait. So the health worker helps you organize and prepare yourself all the time, so that in the case of these conditions coming, you know when, where, and who to see when you have these conditions. Now also, during antenatal care, the health worker discusses with you issues to do with family planning and issues to do with care after you have been delivered. Family planning is important because most women can end up getting pregnant before the desired time they would have wanted to get pregnant if there is no deliberate effort to discuss the family planning options once the woman has delivered. Now, the Ministry of Health recommends that between one pregnancy and the other, the mothers should take at least 2 years. But we've seen scenarios where mothers take less than 6 months and they are already pregnant for the next pregnancy, which of course has troubles because the body has not yet prepared itself for the next pregnancy. Pregnancy being a very demanding situation, a very demanding condition, it needs that the mother is both psychologically, medically, and nutritionally well prepared to handle the pregnancy. The other thing that is discussed during antenatal care is preparation for delivery. How do you prepare transport to the facility? How do you prepare who is going to pick you? How do you prepare the money and it is kept well? How do you prepare for someone to stay with the family when you go to deliver? How do you prepare and have a companion at the time of delivery? Someone that is going to support you, someone that is going to take care of you. And also in this planning, the team, that is the mother and the health worker, identify which facility this mother is going to deliver from. And ideally, the mother visits the facility and understands the range of services, the cost implications for this delivery, and all the necessary requirements that are required. In addition, there are other things the health worker will ask you to prepare, including the beddings for the pregnant mother, the clothing for the mother, for the baby, and all those other things that are going to be important in the delivery process. Currently, there has been something designed as a mama kit that tends to have most of the essential things that are going to be required for a normal delivery. Now, what happens when mothers do not attend antenatal care? When mothers don't attend antenatal care, then we will still see a lot of mothers and babies dying, either during pregnancy or during the time of birth. Pregnancy can run smoothly, but pregnancy can also become complicated. And therefore, that's why it is important for mothers to receive this antenatal care, because the health workers will be able to screen out for all these possible complications, treat them in time, or prevent them. Now, also, delivering at the facility with the health worker is important because the health worker has usually prepared themselves. They have the necessary equipment and medicines to detect, prevent, and control any complications that may arise. So for mothers who do not attend antenatal care, when these complications happen while they are at home or with a traditional birth attendant, there is no preparedness, they cannot easily be detected, and by the time this mother gets these complications, it's too late to save their lives. Then also, those who do not attend antenatal care, they miss out on those other benefits of discussing family size, discussing family planning options, and also having a person to confide in while you're pregnant. Pregnancy can be stressing, emotional challenges, psychological challenges, and during this time you need a person who will understand you, who will be able to explain to you, counsel you, a person you can call at any time you're in need, and they come to your rescue. The question one may ask is, what is this that happens during antenatal care? Of course, for the women who have had an experience, they know what happens, but for the first time mothers and those planning to have babies, what really happens, like I've said, is that first of all, you have what we call a booking visit, and this booking visit is your first interaction with a health worker. Now, during that visit, we call the booking visit, the health worker has to do a thorough assessment of the pregnant woman and look at the risk factors, the things that could make this pregnancy complicated and therefore affect the baby and the mother. In addition to looking at the risk factors this mother has, the health worker goes on and does screening for some of the conditions. So during that first visit is an intensive visit, including blood tests like HIV, syphilis, blood sugar test, hepatitis B, blood grouping, and all these tests are aimed at trying to profile the mother and find out which mother is at risk. During that visit also, which usually takes place within the first month, but preferably should happen the moment the mother gets to know she's pregnant, the health worker also helps identify the location of the pregnancy. Some unfortunate women will have the pregnancy happening in an area other than the inside of the uterus. And these can be potentially life-threatening, especially if the pregnancy grows into the tubes, and then the tubes can rupture and cause catastrophic bleeding. The mother might die. In that visit also, the health worker takes a thorough history, talks to the pregnant woman, identifies their previous experiences with pregnancy, any complications that they could have had during the last pregnancies, and all that is well documented in what we call an antenatal card, which is the woman's passport. This is a card that the mother should always walk with, whether going for antenatal or not, because complications can happen at any time. And once you have this card, anyone who reads the card is able to identify all the challenges this specific mother has had and all the she's gone throughout this pregnancy. So also in that first visit, the health worker educates the pregnant woman about the possible dangers and all warning signs and symptoms that should make the pregnant woman run to the doctor whenever they see these signs and symptoms happening. Now, in the subsequent visits, the health worker keeps monitoring the progress of the pregnancy, looking at how much weight is the mother gaining. Is the size of the baby, the size of the uterus, growing in consideration with what is expected at these months of pregnancy? And the health worker will assess that, and if there are any challenges, address some of them. During these same visits, the health worker can identify mothers who might have more than one babies during this pregnancy, and therefore can identify things like twin pregnancies. Now, also, these visits are intended to screen for the complications we already mentioned. So we screen for hypertension, we screen for diabetes, we screen for HIV, and therefore institute care so as to prevent transmission of HIV from the mother to the baby. And also, like we said, in the antenatal care, we also discuss the breastfeeding plan, we discuss the family planning, and then we also discuss the birth preparedness and emergency readiness. Emergency readiness for complications. What do we recommend as doctors who have been trained to specifically take care of women? We recommend that pregnancy is supposed to be a wonderful experience, and therefore we recommend that we plan our pregnancies. If I know I want to conceive, if I've been on the family planning method and I'm planning to conceive, visit your gynecologist, visit your obstetrician, visit the health worker that is close to you, and discuss with them your wishes. And then from the wishes, the doctor will advise you if you need to delay a bit or if you can go on and conceive. So thank you for watching this show, and for watching the previous shows and the shows to come. We plan to give you more programs related to your health, especially in the field of reproductive health. And once again, I'm Dr. Agawa David Collins. I'm a final year resident in obstetrics and gynecology at Mbara University, Mbara Regional Referral Hospital, and I'm also the proprietor of MRM Clinic and Maternity Center in Rugazi, Mbara. Thank you.
Hey there, do you want to learn camera skills? Do you want to learn how you should record your videos? Do you want to learn different camera settings? Do you want to learn how you should set up your place for a good recording? Just join our online media skills here at AET TV, and we'll be giving you these skills, what you call the 21st century media skills. Check out the numbers you can see right here, and we'll be getting in touch with you.
AET TV, empowering you.